Hi, it's Betsy Nicoletti. Thanks for joining me today. We're going to ask and answer the question, can I get paid for signing the home health certification form? Well, you know the answer is yes, or you wouldn't be watching. So there are two codes. They're HCPCS codes. So they're developed by Medicare, by CMS, payable by Medicare, Medicare Advantage. Whether other payers pay them or not is really up to them. But the first one is G0180, Physician Certification for Medicare covered home health services under a home health plan of care, including contacts with the home health agency, review of reports of the patient's status required by the physician, and the initial implementation of the plan of care that meets the patient's needs per certification period. So when I'm asked, can I get paid to sign the form? You're not really getting paid just to sign the form. You're getting paid for the other pieces that are included in this definition, in this description from Medicare. And that work goes on for a period of time. And the certification period starts as a 60-day period. And then there is a recertification period, G0179. And of course, the patient isn't present for either of these. Who can order and sign the form? In addition to physicians, non-physician practitioners, NPs and PAs can do that. So the CARES Act permanently allowed physician assistants, nurse practitioners, and clinical nurse specialists to sign and provide the service for the home health certification. And this was part of one of the pandemic era changes. The service isn't really the signature. It's the plan is being established and periodically reviewed by the physician, NP or PA. The initial certification is for a patient who hasn't received home health services in the past 60 days, and the recertification is if the patient needs Medicare covered home health services in the next 60 days. A question came up recently about whether you could use this code for Medicaid patients in a state that was giving personal care to the patient, not Medicare covered home health services. And in that case, it doesn't meet the definition that's described in that G0180. During the course of that 60-day certification period, the physician or NP or PA is going to get messages from the home health nurse, may have to call, talk to people. There's work that is done. That is in addition to reviewing the plan and agreeing to the plan by signing the form. It is also payment for all of this non-face-to-face work that you're doing while the patient is being cared for under a Medicare covered home health service. So the billing practitioner is billing for the certification, has to be supervising the patient's care. You're going to use the place of service where the work was done. Typically that's office or outpatient department, not home where the patient is. And you're going to need to enter your provider number, the provider number of the home health agency, and the date of certification in the CMS 1500. And payers will have edits. So if you try to do a recertification at 54 days instead of 60 days, well, you can imagine what will happen. So can you get paid for this certification? Yes. We're not just paying for the John or Jane Hancock, however, it is for all of the work that goes into reviewing the plan, developing the plan, and monitoring the plan during the period. So thank you for joining us today. This is one of our Can I Get Paid videos. There's a lot of information available on Coding Intel, and I invite you to take a look at that. And if you're not a member, become a member. And I always end with my dog, Bo, contemplating. I don't know what she's contemplating. She's contemplating all the things that she would like to do in the next 15 minutes there. All right, thanks very much. Bye-bye.